Hi, my name is Julie Pekarsky. I'm a registered nurse and I work as a nurse consultant. Today we are going to discuss a very sensitive topic. It is a service that all caregivers must provide, and that is assisting patients with urinary elimination. Most of us would consider going to the bathroom a very personal function and would feel quite embarrassed if we had to ask someone to assist us to go to the bathroom. The caregiver must be aware that some people are modest and would feel very uncomfortable if someone saw their private parts or touched their private parts. We must approach patients with an attitude that demonstrates genuine concern and caring for their feelings. Some people are unable to provide proper hygiene or able to toilet themselves safely, so the caregivers must be there to assist them. Body language and facial expressions must show acceptance and genuine concern, and then the toileting experience for our patients will be comfortable and more dignified. We need to learn some basic principles of urinary care and the basic urinary system. The urinary system has three basic functions. They are to eliminate liquid waste products from the body, to manage body chemistry, and to manage fluid balance. The structures of the urinary system are the kidney, the ureters, the bladder, and the urethra. There are two kidneys that filter the liquid waste products from the arterial blood, such as acids and salts. The liquid waste product is called urine. Normal urine is clear and pale to deep yellow in color and has a slight ammonia odor. The ureters are two tubes that carry urine from each kidney to the bladder. The bladder is a bag-like container that stores the urine until it is released from the body. It is made up of muscular membranous tissue that allows the bladder to enlarge when it is filled with urine or shrink when the urine is emptied from the body. The urethra is a tube that carries urine from the bladder to outside of the body. The opening of the urethra allows the urine to pass is called the urinary meatus. The urinary meatus is surrounded by muscles that control the urine flow. Before we go on, we should define some terms. Elimination is a term that refers to when the body gets rid of waste products such as urine or stool. Urination and voiding are two common terms used to describe the elimination of urine. The term urgency refers to that sudden feeling to urinate now. I'm sure we have all experienced this at some time or another. Frequency is another term that describes the number of times a person has to urinate over a period of time. It is when a person is voiding more often than normal. They might request to urinate every 15 to 30 minutes. Urine can be described as dilute, and that term refers to when the urine has more water and less waste products. It will be very pale yellow to clear in color. This may occur when the patient has an increased amount of fluid intake or is taking water pills, which are called diuretics. Urine can also be described as concentrated. That term refers to when the urine has more waste products and less water. It will be very dark in color and have a very strong odor. This will occur when a person has an inadequate amount of fluid intake or may suffer from kidney failure. When assisting patients with elimination of urine, we have to consider some important principles of urinary care. As mentioned in the introduction, most of us would feel quite embarrassed if we had to have someone help us with urinary assistance. Therefore, we must promote independence and dignity by encouraging our patients to actively participate as much as they can in their care. When patients use the toilet, the commode, or the bedpan, it is very important to be professional and help to develop a sense of independence and dignity. To assist the patient to completely empty the bladder, we must be sure that the patient is upright and in a straight position. If the patient is not able to empty the bladder because they have not been positioned correctly, they may ask to urinate again within the next hour. Because of the sounds and odors associated with elimination, it is essential to provide as much privacy as possible for our patients. They might have difficulty voiding when they share a room or when somebody else is present and watching them. Therefore, we must remember to close the doors and the curtains. And we must be sure that they are safe. We should never leave a patient alone. When a patient is able to be left alone, we must be sure that the call light is within their reach or in their hand. Even though most people will urinate better if they are left alone in a private environment, we must realize that there are times when it may not be safe. We must look at the care plan and we must ask, is this person safe alone? If the person is unsteady or weak or they are confused, they may not be left alone. And we also must remember that we may not restrain a person on a toilet to leave them alone. That is an unsafe situation. For the patients, of course, who can't sit alone, again, remember, the call light must be within reach and in their hand. Comfort is also very important. A patient should not be in any pain because they have been sitting for a long time on the toilet or the commode or the bedpan. Please remember to answer your call lights promptly. After the patient has urinated, be sure that the skin is clean and dry. If necessary, wash the skin with soap and water or disposable wipes. Gently dry the skin with a towel. Clean and dry skin is essential in preventing skin breakdown. Also, be sure that the patient's underclothing and undergarments are clean and dry. If they are wet, please remember they need to be changed, or if you notice an odor, please remember to change their clothing. Asepsis is also very important to remember. When the patient has finished urinating and has been wiped, make sure that they have had their hands washed. The caregiver must also remember to wash his or her hands whenever they have touched anything that hasn't come in contact with urine. That would be the bedpan, the commode, the urinal, toilet tissues, wet bedding. And remember, you must be wearing gloves if you're in contact with urine. Please remember to put all these items that need to be cleaned in the proper soiled utility rooms, and then remember that you must not put soiled briefs or toilet tissue in the patient's waste receptacle at the bedside. If you do, remember to remove the bag and take it to the soiled utility room of your facility. The caregiver also must observe the urine for abnormal characteristics and report to the person in charge as soon as possible when he or she has seen any abnormal findings. We will discuss more characteristics of urine a little later. There are several types of urinary equipment you will need to be acquainted with before you assist a patient with urinary elimination. There are two types of bedpan, the standard bedpan and the fracture bedpan. The standard bedpan is large and it resembles a toilet seat. The fracture bedpan is smaller and is designed for patients who are unable to lift themselves up, or they may have broken their hip or broken a leg. To ensure privacy and dignity for the patient, remember that bedpans must have covers when they are brought to the bed and when they are removed from the bedside to be emptied. The urinal is used by the male patient to empty his bladder when he is unable to get up and go to the toilet, and he will empty his bladder at the bedside. The raised toilet seat and grab bars are placed over the toilet to assist some patients to sit down more comfortably and safely. The bedside commode is a portable toilet that is used at the bedside or in a private area. The commode has a pail that is placed under the seat to collect the eliminated waste. The pail must be emptied by hand and cleaned after each use. Add a little water to the cleaned bed pail before it is returned to the commode, so that the pail will be easier to empty if the patient has a bowel movement the next time. Now please watch as the use of these pieces of equipment are demonstrated.
Placing the standard bedpan. First, wash your hands. Explain the procedure to the patient and provide for privacy. Put on gloves. Remove the bedpan with the cover and tissue from the bedside stand and place at the foot of the bed. Lower the side rail on the side nearer you. Keep it up on the opposite side. Ask the patient to flex their knees, resting the weight on their heels, and raise the buttocks. If unable to do so, assist the patient to turn onto their side, away from you, by flexing the upper leg and placing over the lower leg. Place the bedpan against the buttocks and roll the patient back onto the bedpan. Adjust for comfort and replace the top bed linens. Elevate the head of the bed to a comfortable height and raise the side rail. Place the toilet tissue and the call light within reach. Remove the gloves and wash your hands. When the patient signals, put on fresh gloves. Lower the head of the bed, followed by lowering the side rail. Assist to turn the patient onto their side while holding the bedpan flat with the opposite hand. Remove the bedpan and place the bedpan cover on it. Assist to cleanse the perineal area if needed. Female perineum is always cleansed from front to back. Discard the tissue in the bedpan unless a specimen is to be obtained. Replace the bedclothes, changing linens or protective pads as needed. Raise the side rail. Take the bedpan to the bathroom for observation and emptying. Measure the amount if needed. Clean the bedpan per facility policy and return to the storage area. Remove your gloves and wash your hands. Return to the patient's room. Place on a fresh pair of gloves. Provide warm, soapy washcloth to cleanse the hands. Remove the gloves and wash your hands. Placing the fracture pen. Complete the common steps described in the previous demonstration called placing the standard bedpan. Put on your gloves. Ask the patient to flex their knees, resting the weight on the heels of their feet. Have the patient grasp the trapeze bar and raise their hips. Place the fracture bedpan under the patient while holding the handle. The flat end of the bedpan goes towards the head. Check to be certain that the bedpan is positioned properly. Raise the head of the bed to a comfortable height. When finished, reverse the steps and complete the common steps described in the previous demonstration. Placing the urinal in bed. When the patient signals for the urinal, put on a fresh pair of gloves. Obtain the urinal and toilet paper from the bedside stand and place on the bed. Remove the top bed covers and place the urinal so the patient can grasp the handle. Instruct the patient to place the penis in the urinal opening. If he is unable to do so, place the penis in the urinal for him. Replace the bed covers. Have the call light within easy reach. Remove your gloves and wash your hands. When the patient signals that they're finished, put on a fresh pair of gloves. Remove the urinal, cover the lid, and place on the bed. Assist the patient to wipe the tip of the penis as needed. Take the urinal and the toilet paper to the bathroom. Dispose of the toilet paper in the toilet and empty and clean the urinal. Remove your gloves and wash your hands. Toileting on a commode. Respond quickly to the patient who has requested to use the commode. Provide for privacy. Put on a fresh pair of gloves. Position the commode beside the bed, facing the head. Open the lid and make certain that the receptacle is in place under the seat. Lower the bed to its lowest horizontal position. Lower the side rail on the side nearer you. Assist the patient to a sitting position by swinging legs over the edge of the bed. Assist the patient to put on slippers. Apply the gait belt. Assist to stand and pivot the patient to the left and lower to the commode. Be sure to use proper body mechanics. Put on the patient's bathrobe and cover them with a bath blanket. Leave the call light and tissues within easy reach. Never leave a patient unattended if unsteady or feeling dizzy or lightheaded. Remove your gloves and wash your hands. When the patient signals, return to the room. Put on your gloves. Assist the patient to clean their perineum as needed with tissues. Allow the patient to cleanse their hands with warm, soapy washcloth. Assist the patient to stand after removing the bathrobe and bath blanket. Assist the patient to return to bed. Remove the slippers. And gait belt. Adjust the bedding and pillows for comfort. Leave the call light within easy reach. Put up the side rail. Remove the receptacle from the commode and cover it. Take the receptacle to the bathroom. Note the contents and measure the amount if required. Empty and clean it with cold water and disinfectant. Return the receptacle to the commode. Remove and dispose of the gloves properly. Wash your hands and tidy up the room.
One of your responsibilities as a caregiver will be to help the patient who is having difficulty starting their flow of urine. There are several techniques that you can use to help stimulate urine flow. First, ensure that the resident has privacy, that they're comfortable, and that they feel safe. Another technique is to run water in the sink as a slow, steady trickle. Hearing the water flow in the sink may cause the muscles of the urinary system to relax and allow the urine to start flowing. Also, the sound of water running may cover up the sound of urination and provide a more private environment for the shy patient to relax and urinate. Placing the hand in warm water may help the patient to urinate. Pouring warm water over the perineal area also may help. Offering fluids for the patient to drink may help. And sometimes applying a gentle pressure over the lower abdominal area may help them urinate. As you get to know your patients better, you will know which technique works best for them. Another responsibility of the caregiver will be to report abnormal findings. You will listen to the patient describe any pain or discomforts that they may have while they are urinating. You will also report these immediately to your nurse. The things that you may observe and report are urine that is different than its usual straw color, urine that has a strong ammonia odor or any other unusual odor. The consistency of urine that is cloudy or has sediments, mucus shreds, or blood is abnormal and should be reported. Remember, blood sometimes is seen when a woman is menstruating. You must also report less than normal amounts of urine output for your shift. Some patients may put out more or less urine than you would consider normal because it depends on their medical condition. Because it is important to know what is normal for your patients who are on output, please be sure to check with your nurse. Note the perineal skin condition. Note if it's red or tender to touch, or you may see some blistering of the skin. The skin is at high risk to breakdown when it is exposed to the acids from urine or stool. Other abnormal findings that you would want to report are patient complaints of pain or discomforts while urinating, and when the patient has wet his or her clothing due to a sudden release of urine that is unexpected. Caregivers are also responsible for recording the information on their patient's urine output. When monitoring the urinary output, the caregiver must accurately measure the urine by placing a graduated cylinder on a flat surface and reading the output level at eye level. Record the intake and output on the appropriate forms that your facility provides, and report any abnormal findings to the nurse. There has been a lot of information presented in this video, and as you work in your clinical settings, please keep in mind you will be assisting patients with urinary elimination. And if you remember to treat people as you would want them to treat you, then I know that the patients that you care for will have an experience that is most likely comfortable and dignified. Thank you.